Let me ask you something before we even say hello properly. Have you ever stood up, maybe from your favorite chair or out of bed in the morning or after sitting through a long dinner, and for a second or two, the room tilted? Maybe you saw little spots or everything went gray at the edges, or you just felt off and had to grab onto something? If that's happened to you, I want you to keep watching this video all the way through. Not the highlights. All 20 minutes. Because what I'm about to explain to you is something I see in my practice almost every single week. It sends thousands of older adults to the emergency room every year. And yet I can tell you, I have looked. You will almost never find a video about it on social media. Everybody wants to talk about diet trends and the newest supplement. Almost nobody is talking about this. And that, to me, is a real problem, because this one is quiet, it's common, and it's fixable. So let's talk about it properly, no rushing. Hello, and welcome back. For those of you just joining, I'm a physician, and on this channel, I like to sit down with you the way I would with a patient in my office. No white coat theatrics, no scary language, just an honest conversation about the things that actually matter for staying steady, staying independent, and staying out of the hospital as we get older. Today's topic has a long medical name. It's called orthostatic hypotension. But don't worry about that word. By the end of this video, I want you to simply think of it as the standing up dizzies. That's it. That's the whole thing in plain English. Here's why I chose this topic today, out of everything I could talk about. Falls are one of the single biggest threats to independence in people over 65. Not cancer, not heart disease, falls. And when researchers go back and ask, why did that person fall? A surprisingly large number of the time, the answer traces back to a sudden drop in blood pressure the moment they stood up. Not a slippery floor, not tripping over a rug. Their own blood pressure betrayed them for a few seconds, and that was enough. So stick with me. I'm going to walk you through what's actually happening inside your body, why it becomes more common as we age, what the warning signs are, when it's serious, and, most importantly, practical, doable things you and your family can do about it starting today. Let's start with the why. I always find that once people understand why something is happening in their body, the tips make a lot more sense and are much easier to remember. Picture your blood pressure system like a set of plumbing with a very smart pump, your heart, and a network of pipes, your blood vessels that can squeeze tighter or relax looser depending on what your body needs moment to moment. When you're lying down or sitting, gravity isn't working against your blood flow very much. Blood is fairly evenly distributed through your body. But the moment you stand up, and I mean the very instant, gravity suddenly pulls a good amount of your blood down into your legs and your abdomen. In a healthy, younger body, this is not a problem at all, because your body has a lightning-fast reflex. Tiny sensors in your neck and chest, called baroreceptors, detect that drop in pressure within a heartbeat, and they immediately tell your heart to beat a little faster and tell your blood vessels to squeeze tighter, pushing that blood back up toward your brain. This whole correction happens in under 30 seconds in a well-functioning system. Most of the time, you don't even notice it happened. Now here's the part that matters for today's conversation. As we age, several things can make that reflex slower or weaker. First, the blood vessels themselves become a little stiffer and less elastic over the decades. Think of an old garden hose compared to a brand new one. The old one doesn't flex and constrict quite as quickly. Second, the nerve signals that carry that squeeze now message can slow down with age, especially in people with diabetes, Parkinson's disease, or other conditions that affect the nervous system. Third, and this one surprises people, many extremely common medications can blunt this reflex. Blood pressure medications, of course, but also some medications for depression, for prostate issues, for Parkinson's, and even some over-the-counter sleep aids. I'll come back to medications in a few minutes because it's genuinely one of the most important pieces of this whole puzzle. Fourth, simple dehydration. As we get older, our sense of thirst actually becomes less sharp. You can be meaningfully dehydrated and not feel very thirsty at all. And when you're dehydrated, there's simply less fluid volume in your blood vessels to begin with, so that drop when you stand is more dramatic. So when you put all of that together, stiffer vessels, slower nerve reflexes, common medications, and a blunted thirst sense, you can see why this becomes so much more common after age 65 and even more common after 75. The official definition, by the way, if you ever hear your doctor use it, orthostatic hypotension, is when your top blood pressure number drops by 20 points or more, or your bottom number drops by 10 points or more within about 3 minutes of standing up. But you don't need to memorize numbers. You need to recognize the feeling and know what to do about it. That's what we're covering today. Now, I want to gently push back on something. A lot of people hear, "Oh, I just get a little dizzy sometimes when I stand up," and they wave it off. They think of it the way you'd think of a hiccup. Annoying, harmless, not worth mentioning to the doctor. I want to change how you think about that today, respectfully but clearly, because I've seen the consequences of waving it off too many times. Here's what can happen in those few seconds of dizziness. Your brain is briefly not getting quite enough blood flow. For most people, that just feels unpleasant and passes. But for some people, especially if it happens suddenly or severely, it can lead to an actual loss of balance, a stumble, or in some cases fainting completely, what doctors call syncope. And when an older adult faints or stumbles, the fall that follows is often far more dangerous than the dizziness itself. A hip fracture, a head injury. And I don't need to tell you how much a serious fall can change someone's life. Sometimes it's the event that leads to losing independence altogether. There's a study that always stays with me. Researchers have found that this kind of blood pressure drop upon standing is associated with a meaningfully higher risk of falls, fainting episodes, and even a higher risk of certain cardiovascular problems over time, likely because it's often a sign that the blood vessels and nervous system aren't communicating as smoothly as they should be. So this isn't a minor inconvenience. It's often your body sending you an early, quiet signal. And the wonderful news, which I'll get to shortly, is that it usually responds very well to some straightforward changes. I also want to mention, this is different from the dizziness some people feel that's more of a spinning sensation, which often comes from the inner ear. That's called vertigo, and it's a separate topic for another day. Today we're specifically talking about the lightheaded, everything's going gray, I need to sit back down, feeling that comes specifically with standing up. If you're not sure which one you have, that's a great specific question to bring to your own doctor. Let me describe a few groups of people who should pay particularly close attention to this. If you recognize yourself or someone you love in this list, I'd consider this list a gentle nudge to bring it up at your next doctor's visit. Not something to panic about, just something worth mentioning. You may be at higher risk if you take medication for high blood pressure, particularly more than one blood pressure medication. You have diabetes, especially if it's been present for many years, because diabetes can affect the nerves that control this reflex. You have Parkinson's disease or a related condition. You've noticed you're drinking less water than you used to, or you've cut back on fluids because of concerns about needing the bathroom too often. You take medications for depression, anxiety, sleep, or an enlarged prostate. You've recently been sick, especially with vomiting or diarrhea, or you've recently spent time in the hospital or on bed rest, since being immobile for even a few days makes this reflex noticeably weaker. And simply, you're over the age of 75. Studies suggest this becomes quite common in that age group, even in people who otherwise feel quite well. None of this is meant to alarm you. I'm not telling you this so you feel afraid to stand up. I'm telling you this so you know it's worth paying attention to, the same way you'd pay attention to your hearing or your eyesight gradually changing. It's simply part of the honest conversation about getting older that I don't think happens enough. Let's talk specifically about symptoms, because I want you to be able to recognize this clearly in yourself or in a parent, spouse, or friend. The common, milder signs include a brief lightheaded or swimmy feeling upon standing, a graying or dimming of vision for a few seconds, feeling suddenly weak in the legs, or a sense of unsteadiness that passes once you're upright for a minute. But there are certain signs that I want you to treat as a signal to talk to your doctor promptly, not to wait for your next scheduled visit. If you ever actually faint or black out, even briefly. If the dizziness is accompanied by chest pain, a pounding or irregular heartbeat, or shortness of breath. If it's happening every single time you stand, multiple times a day, rather than occasionally. If it's new, meaning this never used to happen to you, and it started recently. A new symptom is always more important to mention than a long-standing one, because it may be telling you something has changed, perhaps a new medication or a new underlying condition. And if you've actually fallen because of it, even if you weren't badly hurt. I always tell my own patients, you know your body's normal. You don't need a medical degree to notice when something is different. Trust that instinct and say something. All right. Now for the part I know you've been waiting for. What can you actually do about this, starting today? I'm going to give you a handful of strategies, and I want you to think of these less like strict rules and more like small habit adjustments. First, change how you stand up. Instead of springing up quickly, try this 3-step pause. Sit up first and pause for a few seconds. Then move to the edge of your seat or bed and pause again. Then stand, holding onto something sturdy, a chair arm, a bed rail, a countertop, and pause once more before you start walking. This gives that internal reflex system the extra few seconds it needs to catch up. It sounds almost too simple, but this single habit prevents an enormous number of falls. Second, pay attention to your mornings, especially the first trip out of bed. Blood pressure naturally tends to be a bit lower first thing in the morning, and after a night lying flat, your body needs a moment to readjust. Before getting up for the day, try flexing your feet up and down a few times, or making a fist with your hands, while you're still lying down. This activates your muscles and helps push blood back toward your heart before you even sit up. Third, mind your hydration, genuinely. I mentioned earlier that thirst becomes less reliable as we age, so rather than waiting to feel thirsty, try to build fluid into your routine, a glass of water with each meal, one when you wake up, one mid-afternoon. If your doctor hasn't restricted your fluids for another medical reason, staying well hydrated is one of the single most effective and simplest things you can do for this issue. Fourth, be thoughtful with salt, but only with your doctor's guidance. Some people with this condition are actually advised to have a bit more salt in their diet, since sodium helps the body hold onto fluid volume. I want to be careful here, because this absolutely does not apply to everyone. If you have heart failure or kidney disease, more salt could be harmful for you. This is precisely the kind of question to ask your own doctor directly. Given my health conditions, should I be adjusting my salt intake for this? Fifth, review your medications with your doctor or pharmacist, specifically for this issue. I really can't overstate this one. Many medications that are entirely appropriate and helpful for other conditions can also contribute to this dizziness, especially when taken together or when a dose has recently been increased. I am absolutely not telling you to stop or change any medication on your own. Please don't do that. What I am telling you is to ask directly and specifically, could any of my medications be contributing to dizziness when I stand up? That single sentence brought to your next appointment can open up a very productive conversation. Sixth, consider compression stockings. These are the snug elastic stockings that help gently push blood back up from your legs rather than letting it pool there when you stand. They're not glamorous, I know, but many of my patients have found them genuinely helpful, and they're worth discussing with your doctor to see if they're appropriate for you. Seventh, be extra cautious after meals and after hot showers or baths. Both eating a large meal and being in hot water cause blood vessels to widen. Digestion pulls blood toward your stomach, and heat pulls blood toward your skin. Either one can make this standing up dizziness more pronounced. So after a big lunch or a warm bath, give yourself that same slow 3-step pause before getting up and walking. Eighth, Make your environment work in your favor. Keep a sturdy chair near the bed. Use grab bars if you have them, particularly in the bathroom. Turn on a light before you get up at night rather than moving in the dark. None of this fixes the underlying issue, but it gives you something solid to hold on to in that vulnerable window of a few seconds. And ninth, perhaps most simply, tell someone. Tell your spouse, your adult child, a close friend, whoever is close to you. Not to worry them, but because two people who both understand what's happening and what to watch for is genuinely safer than one person quietly managing it alone. I want to close this section with real reassurance. If you bring this up with your doctor, there's quite a lot they can do. They can check your blood pressure lying down, and then again after you've been standing for a few minutes, which is a simple, painless way to actually measure this rather than guess at it. They can review every medication you're taking with this specific issue in mind. And in some cases, if lifestyle changes aren't quite enough, there are medications specifically designed to help with this. This is genuinely one of the more treatable issues in all of geriatric medicine. It just requires someone to ask about it. And today, that someone is you. So, to bring it all together, that dizzy feeling when you stand up is not something to just live with quietly, and it's not something to be embarrassed about mentioning. It's common, it has a clear biological reason behind it, and, this is the important part, it responds very well to some genuinely simple changes. Pause when you stand. Drink your water. Review your medication list with fresh eyes. Tell someone close to you what's going on. If this video helped you, or if it made you think of your mother, your father, your husband, your wife, or a friend, please share it with them. This is exactly the kind of topic that doesn't spread on its own on social media because it isn't flashy, but it might genuinely prevent a fall, and that matters more than any trending topic ever could. Subscribe if you'd like more honest, unhurried conversations like this one, and I'll see you in the next video. Take care of yourselves, and stand up slowly.